to Healthy Habits channel. Here we give you the latest and surest health facts as it relates to you. Today we will be looking at 15 things no one ever told you about vaccines and vaccination. Vaccines keep children alive and healthy by protecting them against disease. Yet in 2016, an estimated 1.4 million children under 5 died from vaccine-preventable diseases. Approximately 1/4 of deaths among children under 5 were from pneumonia, diarrhea, and measles, and could have been mostly prevented by vaccines. Globally, 1 in 7 children, over 19 million, missed out on routine vaccines, including 13 million who have never been vaccinated, putting them and their communities at risk of disease and death. With the startling peculiarity of a global pandemic foremost in all of our minds right now, it's fair to say that the whole world is watching with bated breath for when a universally accepted vaccine will be available. But how much do you actually know about the ins and outs of vaccination? In this new video, we'll be showing you 15 things no one ever told you about vaccines and vaccinations. There's a 16 points we added at the end, and it's an epic one. And before we continue, make sure you subscribe and click on the notification bell so that you'll be notified whenever we upload a video. 1. Vaccines prevent more than 2.5 million deaths each year. 2. Not all vaccines are given as shots. Some vaccines are given orally. 3. Vaccine development is a long, complex process, often lasting 10 to 15 years and involving a combination of public and private involvement. 4. The first vaccine was developed in 1796. Smallpox is the first and so far only dread disease to have been completely eradicated by a vaccination. Edward Jenner developed a vaccine in the late 18th century. 5. In the past 60 years, vaccines helped eradicate one disease, smallpox, and are close to eradicating another, polio. Vaccines helped reduce measles deaths globally by 78% between 2000 and 2008. In sub-Saharan Africa, deaths dropped by 92% in the same period. 6. Mothers transmit some amount of antibodies to their babies at birth, which will help them fight infections. These antibodies start disappearing by 6 months of life. Vaccinating babies help to boost antibody levels all over, thereby protecting the child against infections again. 7. Good hygiene can't replace vaccines. Increased medical care, better nutrition, and cleaner and less crowded living conditions have certainly had an impact on the spread and treatment of infectious diseases over the years. But the World Health Organization reports that vaccines have played an even more important role in the drastic reduction of disease. If there's no vaccine for a disease, then all we have is hygiene, says Dr. Edwards, who is also a professor of pediatrics at Vanderbilt University in Nashville. 8. Herd immunity is achieved predominantly through vaccination. When the majority of a population is inoculated against a disease, it facilitates a state of herd immunity. This means that even unvaccinated individuals are largely protected from a disease such as, for example, polio, because the vaccinated majority interrupts the spread of the virus from person to person and thus inhibits major outbreaks. 9. As of 2016, an estimated 86% of children less than 1 year of age were fully vaccinated against diphtheria, tetanus, and pertussis, compared to 52% some 30 years ago. 10. Don't wait to vaccinate infants. A newborn's immune system is still developing, says the CDC, which is why it's important that your child gets vaccines on the recommended schedule. Delaying means increasing the risk of infection. Recommendations are based on what science says about how young immune systems react to antigens at particular times. Vaccinating early and giving your child's immune system time to ramp up means a smaller window of time they might be exposed to an infectious disease. 11. Thanks to vaccines, maternal and neonatal tetanus, which is extremely deadly amongst newborns, has been eliminated in all but 15 countries. Ethiopia, Haiti, and Philippines eliminated the disease in 2017. 12. Sometimes you need more than one shot. The CDC reports that when people get a second shot or a booster of a vaccine, the protection may reach nearly 100% effectiveness. Some vaccines require a third shot. In adults, the TD, tetanus, diphtheria vaccine requires boosters every 10 years. Other adult vaccines that require extra doses are hepatitis A, 2 doses given 6 to 18 months apart, hepatitis B, 3 doses over 6 months, and human papillomavirus, also 3 doses over 6 months. 13. Certain people should avoid vaccines. The CDC and the FDA warn that anyone who is severely allergic to vaccines should skip immunization. However, if you have an egg allergy, it's still recommended that you get a flu shot according to the CDC. There are also groups of people who should avoid live vaccines. If it's a live vaccine and you're immunocompromised, you should not get the vaccine, says Dr. Khan. Most live viruses are not advocated for women who are pregnant. Examples of live vaccines are measles, mumps, rubella, smallpox, and chickenpox. Fortunately, most vaccine reactions are mild, such as redness around the injection site. Only rarely do you see serious reactions. 14. Adults need vaccines too. Regardless of age, almost everyone needs vaccines, and that includes adults, says the CDC. Some childhood vaccines can wear off. Also, adults who might be exposed to new viruses via foreign travel are strongly advised to get vaccinated. Although travel is not advisable right now during the COVID-19 pandemic, when you do decide to travel again, seek your doctor's opinion on what vaccines are right for you. 15. Vaccines are more effective than people realize. No vaccine is foolproof, but the FDA's regulation stipulates that the shot be safe and effective. The agency won't approve a vaccine that doesn't work well. Depending on which vaccine we are talking about, there's a range of effectiveness, says Dr. Edward. The most effective is probably measles, which has 95% effectiveness, 98 to 99% effectiveness after the second dose. Chickenpox is over 90% and DTP about 85%, she adds. Even the flu vaccine, which is developed each year based on projections of which viruses will be circulating, is anywhere from 50 to 75% effective, says Dr. Edward. Number 16. You're not more likely to get sick from the vaccine than the virus. Vaccines come from either killed or weakened germs or just specific proteins from them, which won't cause serious illness. To help the body recognize and fight the disease in the future, the immune system will have the same response it will to a real infection, says Eileen Yamada, MD of Public Health and Medical Officer with the California Department of Public Health Immunization Branch. Vaccines are undoubtedly a miracle of modern medicines. For something that saves countless lives every day, vaccines sure take a lot of heat. The information contained in this video is meant to be helpful and educational, but it's not a substitute for medical advice. Thank you for watching. Don't forget to hit the like button and to share with friends. Please subscribe and click on the notification bell if you wish to receive more videos from us. We love you.